Well, hello everyone, and welcome to our second virtual annual general meeting. My name is Ed Ford, and I'm the chair of the CCG governing body. We've had apologies tonight received from governing body members Lou Evans and Trudy Mann. Arrangements are a bit different again this year, but we're still keen to involve as many people as possible in the work that's taken place across the last year. Tonight's etiquette is shown in the chat bar and helps to explain how tonight's meeting will run. You can ask questions and provide comments through the Q&A function. You can post your question or comment anonymously or by using your first name. We ask you not to provide any personal details or personal identifiable information in your questions and comments to safeguard your confidentiality. And please ask questions and provide comments through the Q&A function. Our moderator will collate all the questions and comments and share these with me at the end of the presentation. Time permitting, we will then answer those questions that we can, but we will be finishing at 8:15 promptly. We will publish all questions and answers on our website in the next few days if you want to check on the website. So, moving on, we've had the minutes circulated to attendees, so hopefully everyone has those. We don't have a virtual hand on this platform, so unless any of the governing body members have a specific objection, which you should send through the Q&A chat bar, I'd like to propose that the minutes are considered approved as a true and correct record. Okay, so now I'd like to hand over to James Rimmer, our Chief Executive, for a reflection of 2020-2021. James.
Thank you, Ed, and good evening, everyone. For those that don't know me, my name is James Rimmer, Chief Executive of the Somerset Clinical Commissioning Group. I have to say, sitting here today, as I am virtually, it wasn't the year we set out to do 2021, as people will imagine, and the continuing COVID pandemic has meant our focus was very much on addressing those issues. I have to say a huge thank you to the people of Somerset, to colleagues in health and care, and to all our partners for the way that we've addressed it. We've had a dual focus for the pandemic. Firstly, on keeping the people of Somerset as safe as we could, and secondly, on keeping health and care colleagues as safe as we could. And I'm pleased to say we've made good progress, albeit with challenges that we'll talk about this evening. Our vision throughout it all has remained clear about supporting the people of Somerset to live, that we work together as partners to improve health and well-being for the people of Somerset. And during the year, we were designated an integrated care system. Again, I'll talk more about that later. We were also taken out of special measures during the year, which is one thing we're delighted with, given the pressure we're under. So thank you to all our colleagues as part and parcel. So if I can move on, please. As I've said, what's driven us is this vision about working together across public services to really improve the lives and the services for our local communities. This has been across all partners, and the CCG's played a key role in integrating those. And we've done this using our values, which were developed by staff colleagues, which focus on quality improvement, continuously wanting to improve and change things to make them better. Through integrated working, through the whole time, seeing how our partners can work together to deliver better care, better services, better prevention for the people of Somerset, for our patients. And individually making sure we do that with integrity, with compassion and self-awareness. And so we've taken that on board across the whole healthcare system. What's the clinical commissioning group here to do? It is really to unite the health and care family across Somerset, take on board the NHS monies and make sure they're invested in the right way. So in simple terms, we plan, we buy and we monitor services for the people of Somerset. That's the commissioning process. And we're very fortunate in Somerset that we have a number of high quality, well-rated providers. And so they're our key partners. If I can take us on to those. Across the year, we have had 65 practices that have worked with us, our GP practices, who've been at the front end of the response to COVID, but are always there at the front end for our patients and the population. We've worked with 4 foundation trusts, 2 based in Somerset, Yeovil District Hospital and Somerset Foundation Trust, which runs Musgrove Hospital, as well as our colleagues across the borders, but the Royal United Hospital serving much of the Mendip population, and United Hospitals Bristol and Western, with Western Hospital serving the North Sedgemoor, and indeed the Bristol Royal Infirmary and the collection of hospitals in the centre of Bristol, providing tertiary services for us, some of those rarer services as well. We've worked very closely with our ambulance service, with our out-of-hours providers, Devon Doctors. We've got independent sector care that really supported us through the pandemic, both in Shepton Mallet and in Taunton. And we've worked very closely with our social care partners and providers at Somerset County Council. So we've been very fortunate, not only with our statutory partners, but also our hospices, our mental health teams, our community teams, and indeed the third sector that have made such a contribution over the past 12 months. So thank you to all partners. Who are we here to serve? So hopefully this is illustrative that if Somerset was a village, and Somerset as a population is 50-50 rural and urban, but if Somerset was a village of 100 people, who would be in that village? So the village would consist of about 24 over 65s, of whom 11 would be over 75s, and that's going to grow over the coming years. So we'll see an increasingly older population. We also serve a significant young population, with 20 classified as children in the village, 20 out of 100, and 5 of those would be preschool and age 4 and under. The good news is that if you live in Somerset, you can have a reasonable expectation of life, with 84 years for women and 80 for men. However, it does depend on the conditions you live in. So deprivation plays 5 to 6 years variation, and so one of the targets we've got both now and going forward is to really reduce the inequality that's inherent in our care system, in our health and care system, and we work very closely with public health colleagues and local authorities to address that. And you can see that 9 out of the 100 would live in a deprived neighbourhood. The other issues we want to pick out is long-term disease and living with that illness, and really making sure that we're addressing the causes of illness and helping people live close to home. I hope we can provide working to provide that care closer to home. And we truly believe that working as partners across the system, so supporting the population across Somerset, 580,000, working together as one place with our primary care networks, our partners, and a local authority, we can provide better services for the local population. We do all that with the benefit of our staff colleagues, and colleagues over the 2021 year have worked flat out to make sure that we get services right for the local population, and a huge thanks goes out from me on behalf of our governing body to all our staff colleagues. They are fantastic to serve us. We've been supporting them as well, and continually wanting to support them. We've focused on becoming a high-performing organisation. We've undertaken the NHS staff survey for the first time, which over 80% of staff revisited, and we've put in place additional well-being measures for them. And we're particularly proud of the Somerset Emotional Wellbeing podcast, which was awarded, which was shortlisted in the Health Service Journal Mental Health Innovation of the Year. All that has been all that's been based on us listening to our colleagues, which we will continue to do. When I look at our priorities over 2021, we set these out in advance. So an absolute focus on listening to our population and our public to make sure that we're meeting needs. I often say the NHS is very good at knowing what to do, but the public are very good at telling us how to do it, and it's that combination, I think, that gets the best effect. I've described a bit, and I'll describe more detail about our working together, But a key one I wanted to draw out here was working together with our voluntary sector partners. And we've seen some fantastic results and input as part and parcel going into over the last 12 months. We have focused on infection protection control, particularly through COVID, which I will draw that out again, but it remains paramount to the way we deliver care, that we can provide that safe. And one area that has been flagged up and was flagged up during the 2021 year, following a visit from Ofsted and CQC in March 2020, was the need to really improve our provision of special educational needs, special education needs for those with disabilities. We've had a significant focus on that, and I believe made stride forwards. There's further work to do, and we will continue to do that. So if I just take us to some of the successes that we've drawn out in that. Firstly, my future strategy you hear more about. We've developed a really positive strategy for Somerset, and we've shared that widely. And again, thank you to all those that have attended our sessions to tell us how we can shape, improve, and develop that as we move forward. Not only did we have a great COVID response, but actually our vaccination program has been tremendous, and I'll cover that in detail later, but it is worth drawing out as a success here. And again, the way we've improved our mental health services, making sure we've got more available in the community. Listening to you, you've asked for more services locally, and we've been able to deliver that. So we're delighted and really proud of the way they've developed. Our management of long-term conditions, we've really been able to move forward and a focus on diabetes and weight management, both of which were risk factors identified early in COVID. And we've done significant work around Diabetes My Way and supporting people managing their own disease, and work very closely with Somerset Active Sports Partnership, SASP, to enable physical activity to take place, particularly supporting those who are having to shield during the pandemic, and really trying to prevent deconditioning and falls which can happen. We also put in place during the year additional community respiratory support that enabled those with respiratory illnesses to be better supported in the community. Finally, I wanted to just draw out our online tools, which we made significant progress on, and the IM&T, the informatics team, said they managed to do 10 years worth of planning in 10 weeks early in the pandemic, so a significant way forward. We've got our Somerset digital record, the CIDR record, implemented, and just outstanding changes, so huge thanks to them. So all that has enabled us to move out of special measures, although I recognise we've still got work to do as a CCG. And perhaps if I go on to then, what is that further work to do? We continue to live with the pandemic. So whilst significant progress has been made, as we'll hear later, we are still living with that, and we need to continue to adjust the way we live, the way we work, the way we function, to make sure that we continue to keep the people of Somerset health and care colleagues as safe as we can, and we continue to do that. It's had a significant impact on our activity levels and our performance. We started the 2021 year with about a dozen patients waiting over a year, and we finished with about 2,500 patients, which we know has a major impact on people's lives, which we're sorry. We managed to make some recovery last winter, and looking forward, we will continue to make progress against the recovery, but recognise the challenges that sit within that. And finally, I just wanted to flag up our financial position. So in year, as you will hear in a minute, we made great progress, which is a great baseline to start with, but we've got an underlying deficit that we need to continue to address. We will do that by working together, which will move us forward and get the right outcome, not only for patients, for our service, for the local population, but we believe we'll deliver it more efficiently and effectively. So, Chair, if I may, with that as an overview of the year and with our kind of covering the kind of highlights and challenges of our annual report, I'll now hand over to Alison Henley, our Director of Finance, who will take us through our annual accounts. Alison, over to you.
Thank you, James. So I'm Alison Henley. I'm Director of Finance, Performance and Contracting for the CCG, and it's my pleasure this evening to present the annual accounts as part of our AGM. We aim to be a responsible commissioner who makes the best use of the money and resources that are made available to us to support the people of Somerset. The accounts I'm presenting today relate to the period the 1st of April 2020 to the 31st of March 2021. When during this time we spent 993 million on healthcare services in Somerset, and this equates to approximately 1,700 per head of population, and I'll come back to that in a second. So this slide shows an illustration of how we spend our Somerset pound, and the slide on the screen shows a breakdown of this. And I just wanted to bring to our attention a few areas to highlight from this slide. So we spend approximately 50% of every pound we spend on secondary care commissioning, and this relates to the services carried out in acute hospitals, with the majority of the spend being in Somerset Foundation Trust, Yeovil District Hospital NHS Foundation Trust. But we also buy services from other providers, which includes Royal United Hospital Bath, University Hospitals Bristol and Weston, North Bristol and Royal Devon and Exeter NHS Foundation Trust, to name a few. We spend approximately 20% of our funding on primary care services, and this includes both services provided by GP surgeries and the cost of any medications prescribed to the people of Somerset. Finally, I just wanted to draw out under 10% of our spend is on community services, where the majority of the spend relates to community-based services supplied by Somerset NHS Foundation Trust, but also includes services bought jointly with Somerset County Council, non-emergency patient transport services, and hospice and end-of-life care services. So just to move on to the next slide, which shows how we have delivered our financial performance targets during the year. And this shows that during 2021, we achieved all the performance targets set to us by NHS Improvement in England. In March 2020, as a response to the COVID-19 pandemic, NHS England and Improvement issued guidance which fundamentally changed the financial arrangements for the NHS and suspended work on the annual planning process. We quickly adopted a revised approach to financial management for the CCG, with the expectation that during the period, the 1st of April to the 30th of September, CCGs would be expected to financially break even. Somerset CCG expenditure was fully funded for this period, enabling the organisation to achieve this break-even financial position. For the second half of the financial year, ICSs were issued with fixed financial envelopes. The Somerset system submitted financial plans to NHS England and NHS Improvement, demonstrating how these would be used to achieve a financial break-even position for the remainder of the year. And this position has been delivered as shown on the slide. This means that the CCG delivered a year-end financial position within its total allocated financial resource. So the last slide for me just shows how we've spent our money. And just to remind the audience, we spent 993 million on healthcare services in Somerset. And this slide focuses on where does that money go. Here we can see that we delivered the break-even position for our spend in 2021. And just to draw out again another couple of areas from this slide, the CCG spent around 74 million on mental health services. Most of this spend is with Somerset NHS Foundation Trust, with additional spend supporting mental health aftercare services, children and young people through the voluntary sector, and dementia services provided by the Alzheimer's Society. 50 million supports continuing health and funded nursing care. This supports people who need additional support in nursing homes or in their own homes. And finally, just to draw your attention to the CCG receives a separate funding allocation for the day-to-day running of the organisation. And this accounts for just over 1% of our total spend. So I'd like to hand over to Judy Grant, who will now give us an update for COVID-19.
So, evening everybody. My name's Professor Trudy Grant. I'm Director of Public Health for Somerset. And as Alison said, this part of the agenda is looking specifically at the pandemic and what we've all experienced over the last year or two. So we've had nearly 40,000 confirmed cases of COVID in Somerset. The chances are that's an underestimation because we know that there's quite a fair proportion of people that actually don't experience any symptoms for COVID. So actually that there will be considerably more than that. But even then, the Somerset rate is about 2/3 of the England average, and really that achievement is down to the Somerset population. You know, it's a huge thank you to everybody who's made sacrifices over the last 2 years or so to make sure that we try and keep our infection rates as low as we possibly can. So the next slide shows what's called our epidemiological curve, which is the graph which really tracks our infection over time in Somerset. So you can quite clearly see from the graph the first wave, which was slightly smaller, the second wave and the third waves of the pandemic. The current infection rate for Somerset as of today is 294 per 100,000 population. And at the moment, we're on our way down slightly. We were quite high over the summer, as was most of the southwest. So as with all pandemics, actually, the rates of infection will fluctuate for various reasons over the time, and we'll wait and see how infection rates progress over the winter period. Looking at the next slide, sadly, the virus has posed a significant risk to life, and like many pandemics, it has led to deaths. Older people and people with particular comorbidities have been especially vulnerable. And whilst we can see the numbers here, actually every death is a tragedy, and we must remember that behind all of these individuals that have sadly lost their life, there are friends and family who've unfortunately no longer got their loved ones with them. And so much of what we have sacrificed over the last 2 years has been in an effort to try and keep the deaths down to a minimum and reduce the direct impacts of COVID, particularly on vulnerable people. But we have sadly seen over 800 deaths due to COVID in Somerset since the start of the pandemic. Again, that's a lower rate than the England average, which probably reflects our lower rates of infection overall. But I think what's really important to point out is that actually that's an unstandardized rate. So it's not adjusted for our age in any shape or form. And we know that Somerset's got a slightly older population. So actually, if that rate was a standardized rate, the chances are that the actual death rate would be even lower than the comparison to the English rate. On the next slide, on this slide, you'll see that deaths do fluctuate year on year. And so we tend to measure deaths in a range of a 5-year high and low. From this graph, you can see that overall the deaths in Somerset have largely stayed within the 5-year range. And really, they've only gone higher really at the very beginning of the pandemic, when we were still learning about this new novel virus and what the implications of it were. So looking forward then, if you move to the next slide, importantly now, as James has said already, we've got to learn how to live with this new virus. It's going to be staying with us for the foreseeable future at least. And we've got to take responsibility for reducing the spread of the infection and protecting the most vulnerable in our society. one of the really key milestones of this has been the fantastic vaccination program. And actually, if we hadn't have had the vaccination program come along quite so quickly and been rolled out quite so quickly, we would have seen far more deaths, and we would have had considerably more impact as a result of this pandemic. So we've got an awful lot to do looking forward, as you can see from the slide. We need to make sure that we keep an eye on out for new variants of the virus. As you know, we've seen several variants already, so we know that it is a virus that does continue to provide new variants for us to try and understand. But one of the really important things is that actually we carry on with the vaccination program and we continue to learn about this virus, how it affects our lives, and how also going forward how we can treat the illness that it develops. So now I'm going to hand over to James, I think on behalf of Dr. Alex Murray, to take you through the vaccination programme.
Thank you, Trudy. Yes, and can I give the apologies of Dr. Alex Murray, our clinical director, who's unable to be with us this evening as she is unwell. But I did want to pass my thanks on to Alex and to all our clinical colleagues across the system and in the CCG for the work they have done on the vaccination, on the COVID programme, our response to it, and the vaccination programme, which I'll take us through now. The COVID was declared a worldwide pandemic on the 11th of March, and we had to mobilise across the system, across all health and care organisations to respond to that. Clearly it came fast, but we'd started our planning in February and we were well prepared and working with colleagues. Some of the highlights and challenges was particularly the way our colleagues responded to that. CCG staff went onto the front line going into our acute services. We were able to redeploy some of our continuing healthcare colleagues into the community. And indeed, almost everyone in the organisation, no matter what role they did, changed their role to respond to the pandemic. So huge thank you to that. There was a huge change to the video and online consultation, both for day-to-day working, but I think also particularly for care. And again, when we've done surveys, 80% of the population of Somerset have found that acceptable. So that transformation was was enormous. Most of that happened with primary care, and a big change the way GP consultations took place, and our IT team took 600 laptops out to them. That really made it transformation the way we work. The other big focus working with our colleagues at Somerset County Council was the PPE agenda, personal protective equipment. And as people would be aware, it's hugely challenging at times, but nevertheless we worked hard to make sure that was available for all our colleagues throughout the pandemic. We commissioned a number of community swabbing services so we could keep the testing program going, and I think a significant area of change for us was around mental health. In particular, we had a 24/7, so 7 days a week, all hours, mind line, crisis telephone line available, and we know it was well used by young and by olds. So the services, so we were delighted that we were able to put that on at such short notice. We created safe spaces, and we made sure that our A&E departments were appropriate for people, both for physical and mental health issues as part of that. As we looked to address it, we really supported people around end of life. So Trudy's highlighted over 800 lives lost. We're hugely thankful to Marie Curie for the support they gave us to enable us to train families to have those end of life conversations. And indeed, our chaplains and our partnership with the Diocese of Bath and Wells to support those conversations, again with families and staff to support them. I also highlighted earlier the issue of inequalities, and if anything positive has come out of this is the work we've done on homelessness, and really all partners across all public sector partners working and voluntary sector across Somerset to really provide better care for our homelessness, Everyone In campaigns where we can bring people off the streets, flu, dental hygiene, sexual health, addressing those issues. We visited every Gypsy, Roma and traveller encampments and supported them. We worked with Health Watch, and indeed we also provided and listened to our young people, 2BU Somerset, for those identifying as lesbian, gay, bisexual and trans to explore their experience. So overall, a very positive response to the way the pandemic was managed. I have to be hugely thankful for colleagues. As Trudy said, one of the ways we then were able to deal with the pandemic was through the vaccination program. And Alex Murray was our senior clinical lead, and indeed jointly with Andy Heron from Somerset Foundation Trust, the joint lead for the vaccination program for Somerset. So hugely thankful to them for the program. We work together with partners across health and care, with an army of volunteers, with all our public sector colleagues, with our voluntary sector to make a difference. We set up 21 vaccination sites across the country. Starting early in December, we were one of the first sites, first counties to go live early in December. And we had 2 hospital hubs, 13 GP-led community locations, 2 large vaccination centres in Taunton and in Shepton Mallet, and then the pharmacy site. I was delighted that that was recognised by the Earl and Countess of Wessex, who visited the team at the Bath Showground during this year to thank all those present for the work they were doing. Really, really positive as part of that. Also, our GP colleagues, on top of everything else, were doing roving vaccination sites, particularly to care homes, to make sure the programme went out to everyone. The outcome of that, I'm delighted to say, if we go on, was that we managed to vaccinate 836,000 people. We have vaccinated as many, we're well ahead of the national figures. We're one of the leading systems in the country for rolling out that vaccination program, and that continues with the rollout to most recently the 16 to 17-year-olds, and we've made progress on that ahead again of the national ratings, and then moving on to, we will be moving on to the younger age groups as and when the guidance comes out, the detail behind the announcements we've heard the last day or two. So we will be prepared for those. What I wanted just to move to now then is to show you a video of how this has been received within Somerset. And so people can say it better than me.
I think everybody should have a go at this one. It's so important and it's so essential. I mean, it's all over so quickly. And then 3 days ago, I had the phone call. It's all so quick. And it's not a lot of hanging around, wasting time or anything. It's very, very tightly done.
For me, it's been an absolute pleasure working at this Shape Mendip vaccination hub. It has been a true partnership between 5 GP practices, between Mendip County Council, who have been absolutely amazing. Also, Somerset Partnership and Somerset CCG have been absolutely brilliant.
I've been really proud to be part of the NHS and being able to deliver this. I've had a fantastic clinical team to work with, and for me, it's how positive to enter 2021 after the year we've had with being able to deliver this vaccine and hopefully support the population of Somerset with a future better health.
The patients that have come in have been absolutely wonderful, and it feels so great to be able to offer this vaccine at a time when we as GPs know what everybody in the community has been through over the last year.
There's no grief, there's no pain, no suffering, and just go for it. You know, it's so easy.
Just go for it. Great words there from Michael Evis, and huge thank you to Amelia and Emma there running the Mendip Centre, but to colleagues right across Somerset for that programme. So thank you. I am now going to hand on to Maria Hurd, our Director for Strategy, who's going to take us through our Fit for My Future programme, which talks about how we're going to move services forward together for the people of Somerset. Maria. I'm afraid you're on mute, Maria, so.
Apologies, everyone. There was always going to be someone that put themselves on mute, and that's me tonight. Fit for My Future is Somerset's health and care strategy, which is aimed at supporting the health and wellbeing of everyone in Somerset by changing the way we plan, buy and provide services in Somerset. It's a joint strategy between Somerset County Council and ourselves, in collaboration with our partners at Yeovil District Hospital, Somerset Foundation Trust, who deliver our mental health services, our community services, and deliver services from Musgrove Park Hospital, and the voluntary sector. And we started that in April 2018. We want people in Somerset to live healthy, independent lives for longer, supported by thriving communities, but we can't do it alone. And we've seen the huge role that our communities have played during the COVID pandemic. For everyone in Somerset, we will enable people to live healthy, independent lives and prevent the onset of avoidable illness and support active self-management. Ensure safe, sustainable, effective, high quality and patient-centred support in the most appropriate setting. Provide support in neighbourhood areas with an emphasis on self-management and prevention, and value all people alike. Address the inequalities that we have seen through COVID, and give equal priority to mental and physical health, and improve the outcomes for people through personalised, coordinated support. We want to help everyone live healthier, independent lives for longer. Together, we're working to build a health and care service in Somerset that is truly fit for the future. As part of the newly formed integrated care system, and James will talk about the integrated care system later, we plan to continue to transform our out of hospitals care beyond the traditional primary and secondary care divide that we have and we see. We plan to redesign community-based services in their broadest sense, enabling voluntary sector organisations and the population themselves to define the way we work in the future. And we want to blur those boundaries between mental and physical health across prevention, early intervention, primary and secondary care, working on the basis that your bed is the best bed, and we support you there. We want to enable care to be delivered as close to home as possible by the right person at the right time in the right place, whilst ensuring that high quality, safe and sustainable care is provided in our community and acute trust for those who need it. For most of the last year, our work has been paused while we've supported the COVID response in Somerset. We've been able to continue work in two key areas, which I want to cover in more detail. We continued our work within mental health, realising that supporting people's mental health would be a priority in the pandemic. We concluded our consultation on the future location of our adult mental health wards in Somerset. These wards care for a small number of the most unwell individuals with a mental health condition and provide care for all of our residents in Somerset. In September 2020, our governing body approved a proposal to relocate 14 adult mental health beds from Wales to Yeovil. That decision followed a 2.5-year period of engagement and consultation with staff, patient, carers and colleagues in the voluntary sector and people with an interest in mental health, to co-create a new model of mental health care for Somerset, which offers a full range of support from prevention and maintaining well-being right through to crisis and inpatient care. This proposal will help us to make sure that all adults across Somerset have access to safe, high-quality acute mental health services when they need to. By relocating the beds from Wales to Yeovil, we can co-locate the two wards to provide support to staff on either ward in the event of emergency, extend medical cover and ensure that wards are close to an emergency department in the case of a physical health need. And that co-located wards was a real benefit during COVID. We continued to develop the new and deliver the new model of mental health services, which received national recognition and an additional investment of funding. This meant we've been able to invest more money in services delivered locally to the community. And that means that by investing more money and support earlier on, people don't need to be admitted to hospital. And when people do need to be admitted, we provide stronger support for those that have been discharged to help them transition back to their communities. We have developed an emerging model for the potential configuration of community-based health and care services. This will support people to live independent, healthier lives by having the right services in the right place to meet their needs. We shared this emerging model of community-based health and care services last year between January and April. The purpose of the engagement was to share our early thinking about how we might better meet the needs of the population. We asked people for their views on this early thinking so we could take them into account in shaping our ongoing thinking and development of that. I'd like to say thank you to those that took part in that process. Your insight and comments have been invaluable. Due to the COVID-19 pandemic, the release of the independent report onto those comments was paused. The findings now have been shared with Fit for My Future Programme Board and the CCG governing body, and will now be shared publicly. The learning from the pandemic will be incorporated into the next phase of our work, and we will continue to engage with the public and wider stakeholders to gather views as our thinking continues. We will continue we're holding a feedback event on Monday the 27th of September at 6 p.m. and I'd invite you to join us by Zoom. It'll be your opportunity to hear details of the feedback and the comments provided during the engagement and learn more about what we're going to do next. To book your place, we'll be publishing the link to that shortly on the CCG website. So I'd invite you to have a look at the CCG website, and we'll also be sharing that widely and inviting people to attend. Thank you. I'm going to pass on to Val Jansen.
Good evening. My name is Val Jansen and I'm Director of Quality and Nursing at Somerset CCG, and tonight I'm going to talk to you about quality improvement. So the improvement of quality and patient safety is the organising principle of our health and care services. It's what matters most to people who use our services, and it's what motivates and unites everyone working in health and care. Our key focus is to ensure that quality and patient safety is built into commissioning structures, values, practices and business processes through the annual cycle of clinical quality activity. So during 2021, our quality monitoring and quality improvement activities were very much shaped by the COVID-19 pandemic. And we continued our quality monitoring activities, but this was under a very reduced quality monitoring framework as set out in the national directions. However, I'm going to share with you a number of quality improvement highlights. So James has already talked about redeployment of staff. Very early on in the pandemic, we worked really closely with Trudy and public health colleagues on various aspects of the pandemic, but we recognised there was a need to support the increased demands of frontline staff. And to do this, both the CCG and commission providers redeployed many of our staff with quality and safety functions to operational service delivery roles, for example, into intensive care and community nursing. Preventing and controlling the spread of COVID-19 became the CCG's priority through 2021, and we work collaboratively with a number of agencies, communicating the infection prevention control messages, engaging collaborating with primary, secondary health and social care providers to apply the national guidance within their settings and to protect the population against the transmission of the virus. We marshalled our quality improvement activities to centre on those that would have the most impact on the safety and quality of services during the pandemic, and the most critical element of this was to support our care homes. At the beginning of the pandemic, the Somerset system recognised the importance of supporting care homes. This involved twice-weekly calls to all care homes within Somerset to ascertain what support they needed that week. We have received positive feedback about how well our care homes felt the health system has supported them. During the past year, it's been more important than ever to ensure that the transfer of care for people requiring movement and contact only happens when needed. So we continued with the rollout of an existing programme for the early recognition and escalation of treatment for rapidly deteriorating patients. This was expanded from pilot sites to the whole of Somerset using the Restore 2 and Restore Mini tools, which support health and care colleagues to identify, respond and escalate deterioration using a common language. This means that communication about people whose health is deteriorating is carried out using a highly reliable system to support clinical decision making about hospital admission. As you can imagine, this was especially critical during the pandemic to ensure the swift transfer to hospital when needed, or to remain and be cared for at home when hospital treatment wasn't necessary. As part of the COVID-19 response, we worked to develop a multi-agency support process to assist the management of COVID-19 and outbreaks in GP primary care services. This support process provided GP practices with a full risk assessment service and advice about infection prevention, control and business continuity. We worked very closely with Alex Murray on the COVID vaccination process and supported the quality assurance aspects for the setup of our GP community vaccination centres. In recent years, we've been working more closely with service providers to reduce organisation professional boundaries. The pandemic has had a positive influence in this respect and fostered stronger ties between services to achieve the best possible outcomes we could for our Somerset people. This was especially prominent in the way we worked with our care home providers, and it has created a much improved foundation for us to work across health and social care in the future. We continue to ensure the protection of our most vulnerable people in Somerset, maintaining our statutory functions for the safeguarding of adults and children, and we set up a multi-agency safeguarding cell which developed a collaborative approach to safeguarding risks and challenges by all partners as they arose. Following a review against the national guidance, I'm pleased to say we increased our safeguarding adults provision this year, and we appointed a named GP for safeguarding adults and a deputy designated nurse. The named GP and deputy nurse work alongside the designated nurse for safeguarding adults, and the team provide expert advice and guidance to the CCG and our providers in order to fulfil our duties. In relation to domestic abuse support, the CCG made money available to support our hospitals and community services to support people who use our services and are experiencing domestic abuse. The money funded 2 posts called Health Domestic Violence and Abuse Advocates, and their role is to educate and support staff working in our trusts and GP practices about how to support people who are experiencing abuse. And finally, we're very proud of one of the projects we worked hard on during 2021, which was that we worked with our Registered Care Providers Association and with Primary Care to run 2 projects to improve the quality and uptake of annual health checks linking with the learning disability mortality reviews. The national target is 67% for all the annual health checks to be completed by the end of March 21, and our early indicators suggest that we achieved 80%. I'm now going to hand over to Neil Hales, who's our Director of Commissioning. Thank you.
Hi everyone, I'm Neil Hales, Director of Commissioning, and I wanted to highlight our ongoing work in respect of recovery from the pandemic, and in particular focusing on elective diagnostics and cancer care, the work we're doing around digital health inequalities and our people. Just to give some context, elective care in our acute hospitals was operating at half of their theatre capacity during the second wave of COVID when it peaked in late January. And that was because we had to change theatres into critical care capacity. Subsequent to that, from late March, we've been those theatres came back online, and we've been increasing our operating capacity, including utilising additional monies available through the Elective Recovery Fund. We've also been redesigning our pathways and increasing our use of the independent sector to ensure that we can provide greater elective care and reduce patients' waiting times. And there's been a particular focus on orthopaedics and ophthalmology, as these are traditionally very large volume specialties. Our diagnostics provision is going to be further expanded with the new Rutherford's Diagnostic Centre, which opens in November. And this will provide us a greater MRI, CT, echo and ultrasound capacity, And it's going to actually be one of the things which will help us, one of the measures which will help us in terms of assisting our aim of achieving the 99% standard for all diagnostics to be seen within 6 weeks by the end of March. Increasing our diagnostic capabilities assists both our elective and cancer pathways, and we are working closely as a system under the guidance of the Somerset Cancer Board and the Cancer Alliance to improve earlier diagnosis. This includes the development of a support tool for primary care to help identify potential cancers and ensure quicker referral. Also, I would note that we've been doing some work in terms of rapid diagnostic services which are in place to support cancer care. We recognise the need to reduce waiting times much further, and though Somerset is consistent with the national picture in respect of elective diagnostics and cancer waiting times. In terms of digital, during the pandemic, we saw the rapid introduction of digital tools to enable the remote delivery of health and care services, and almost a quarter of outpatient attendances over 2021 were delivered in a non-face-to-face manner. Our plans for 21-22 build on this and other digital transformations that took place as a result of the pandemic. There is a widespread awareness that there are individuals and communities who are unable to access digital healthcare options though, and as part of our processes we've developed a system-wide Somerset Digital Inclusion Plan, and that plan it will continue to evolve over time as we increase our understanding of using digital tools to enable that we can deliver health and care services effectively. In terms of health inequalities, we've already covered some examples of the health inequalities work during the pandemic earlier, but I just wanted to link that into the work that we're doing in terms of the elective care programme. One of the aspects which we're doing is linking our waiting list information and referrals information to geographic mapping of areas of deprivation, and by doing that we'll have a better understanding of access times and levels of demand by deprivations that we can actually start to make active health interventions and really address some of those health inequalities. We also have a number of preventative programmes which will be proactively engaging those at greatest risk of poor health outcomes, and these include our local healthy weight strategy, the National Diabetes Prevention Programme, and the rollout of our social prescribing model. Just want to talk about our people as well. The past year has been unprecedented year in terms of our staff, for our staff, and our people are at the heart of our plans. And with this in mind, we've ensured that our staff get the support they need going into 21-22. We've refreshed our Somerset People Plan and have strengthened our governance to ensure the delivery of plans and actions. We are very proud that our integrated care system is one of only 7 national pilots to develop an enhanced occupational health and wellbeing officer directly for our health and social care colleagues in Somerset. We continue to embed new ways of working and transformation across Somerset, including our e-rostering system, which will be extended into primary care networks. We continue to consider the agility of our working arrangements for our staff and have flexible working arrangements in place. In terms of recruitment, we're developing service-specific workforce strategies for staff and recruitment retention, and developing an approach for selling Somerset as an attractive location for health and care professionals to work and live in. And also looking at and establishing our grow our own approach for hard to recruit services. We do have a good understanding of where our workforce challenges are in the system and the impacts on patient flow and care, and these may have, and are working with system partners to address these. We have recently used our sector-based work academy programme, which is called SWAPS, and we use that to train lay vaccinators as part of the vaccine programme. And we'll also be looking to create more opportunities from that programme, as well as developing staff banks to supply areas within the NHS which are under pressure. Thank you for your time. I'm now going to hand back to James, who will be talking further about the ICS.
Thank you, Neil. Much appreciated. So I'm going to draw together last year and start looking forward. So I'll touch on the integrated care system, but also our priorities for 21-22, the year we're in and moving into, looking forward. So as I've mentioned, we were designated an ICS in December 2020, and there are 42 ICSs, so integrated care system or ICS. There are 42 ICS across England, with Somerset being one, with the aim that each ICS locally joins up care settings across hospital, community services, physical and mental health, and indeed social care. And as I say, what it does really is try to mirror people's lives. So we join up our services to meet your needs. And ICS brings together NHS trusts, GPs, clinical commissioning groups, local authorities, voluntary sector partners, to bring services together in a way that improves health and reduces inequalities. The ICSs depend on collaboration, a focus on place, and they've grown out of the Sustainability and Transformation Partnerships, STPs as they were called, which started in 2016 to plan services for local areas. This is based on meeting the needs of the changing population and ensuring our services change to meet those needs. People are living longer, as we've heard, and living with long-term conditions. So working to meet those needs is good. It needs to happen. And as a result, we need to change the way we deliver services and provide care closer to home, more in the community, and breaking down the barriers between services. This means we can better provide services that meet your needs. ICSs absolutely have the potential to drive that improvement in services, particularly improvement in population health and tackling health inequalities by working alongside our local authority partners and addressing the wider social and economic determinants of health. And we believe absolutely that by this joint working better together, we can better meet the lives of the community we are here to serve. So at present, ICSs aren't legal entities. The legislation is currently going through Parliament, and we expect to be legislated from April 22. Let me show you this video by NHS England and Improvement that just describe what an ICS is, and then I'll come back to what that means for Somerset.
What if there was a way to help people get the care and support they need without having to overcome the barriers that exist between the different parts of our health and care system? For example, between health and social care. What can we change so that our health and care system becomes even better at helping us all to stay healthy? This might mean health and care professionals acting earlier to prevent illness and working in partnership with other sectors to tackle some of the causes of ill health. For example, poor housing or unemployment. Access to joined-up care and support has been a challenge for many years. One of the lessons from COVID-19 is that people need support that is joined up across local councils, the NHS, and voluntary and community organisations. Our best outcomes have happened when organisations have collaborated, sharing resources and making decisions quickly to provide the support that local people need. Deeper collaboration between the NHS and local councils is already becoming a reality across many parts of England. We are creating 42 health and care systems across the country, known as integrated care systems. They bring together professionals from a broad range of organisations to find and deliver the best way to support people in their local communities. They are joining up budgets, which means they can invest in services to meet the specific needs of the places they serve. Practical improvements have been made to people's lives, thanks to more convenient and personalised care and closer coordination of different services. During the COVID-19 pandemic, GPs, councils and charities joined forces to help quickly identify and support those at greater risk from the virus. People sleeping rough were given good accommodation with care and support around the clock. And hospitals worked together, sharing staff and resources so that everyone could get the help and care they needed. Integrated care systems will embed collaboration and help the NHS and local councils respond to the challenges we face beyond COVID. We want to make them as strong and effective as possible in every part of England. As needs change, with more people living into older age and with long-term conditions, we will need to continue to adapt the way we organise care. And by working as partners with a shared ambition to help our communities thrive, we achieve the best for everyone.
So hopefully that's given a really good impression that the goal of ICS is about removing barriers between organisations for better care for joined up local communities. I believe in Somerset we're well prepared for these changes, the benefits outlined there. We've started working 4 years ago together, and we've demonstrated, particularly through the pandemic, but leading up to that, that working together we can provide better services. So the ambition is a significant challenge for us, but nevertheless welcome, and one we're embracing in Somerset. Let me take you on to some examples of where we're already working better. I've described the vaccination program, but also our long COVID recovery service. The way we're working together to to transform hospital discharge to make sure we're receiving people better into their own homes, providing mutual aid to care homes and better access of equipment, the partnership working with the voluntary sector, the way we're embracing 111 to support our urgent care response, the launching of safe crisis space and mental health and the 24/7 helpline, and then our integrated care record, the sum at the side of the digital record. They've all been made possible by us working together. We recognise there's much more work still for us to do, but nevertheless we believe we've made a great start, and we've got across the system the talent, skills, passion, energy and commitment to colleagues to take this forward, and together we genuinely can better understand, plan and deliver better services for the better outcomes, health and well-being for the people of Somerset. And we'll bring this together next year by drawing together our priorities for the coming year. Particularly we want to support our colleagues, the work they've done in delivering COVID, but also the work they're now going to do on taking forward the recovery program. We'll continue the vaccination program as that rolls out. We'll learn from the pandemic and we'll support capacity in primary care, so those frontline services are there for you. We really want to think about how we move these services forward across the system, transforming the urgent care demand, which has been so challenging over this summer period. And then clearly, as I've described, we will be transforming and transitioning the CCG into an integrated care board. Probably initially there's an element of transfer, but really looking forward, how do we transform so that that integrated working comes alive and we can align our functions across public services to better support the ICS. So with that, and throughout this presentation and throughout our talk, I hope you realise what we want to do is listen more to you. So let me just hand over to David Heath, who is our non-exec director, who is driving forward the engagement agenda on behalf of NHS Somerset CCG. David.
Thank you, James. We have a legal obligation to involve the public both in how we plan services and in any changes to current services. But we want to do a lot more than that. We want to make sure that the patient and the public voice is at the heart of everything we do. Our ambition is to be a system leader that supports our providers to improve and to innovate. Participation helps us to understand people's needs, improve access to services and reduce health inequalities. Throughout the pandemic, we worked in line with national COVID-19 good practice guidance for engagement practitioners. We reviewed and we adapted the way we worked using new digital tools and methods so that we could continue our involvement and engagement with the public. We're committed to continuing to engage with the people of Somerset and to review and improve the way we do this. So what are the highlights of this year? Well, we developed a Somerset Citizens Panel to help us engage with and hear from more people. We co-produce a stakeholder database with Spark Somerset, helping us to reach communities we don't always engage with enough. We completed a formal public consultation on proposed relocation of acute inpatient mental health services. You heard about that earlier. We utilised our Somerset Engagement Advisory Group, what we call SEAG, to check and challenge our commissioning decisions, plans and communications. And we heard from 307 children and young people about their views of emotional health and wellbeing services in Somerset. We worked with Somerset diverse communities and Diversity Voice to ensure our communications meet the needs of our ethnic minority communities. And we continue to provide our patient advice and liaison service, PALS, which supported 589 people to find the information they need about NHS services in Somerset. We continue to work closely with our community and voluntary sector colleagues across Somerset, enabling us to reach more seldom engaged communities. And we'll continue to use the feedback we receive from patients and carers, Health Watch Somerset, and our engagement activities to shape and improve our services. By listening to you and talking to you about the things that are important to you, we'll be able to improve the quality of the services we commission. And that'll make sure that the right services are available in the right place at the right time for you, your family, and your friends. There for you when you need them. So by working together, we can make a real difference to the people of Somerset. And there are a lot of ways you can get involved, have your say, help us to shape our services. They're on the screen at the moment. Join our citizens panel, become a people champion, sign up for our engagement newsletter, join your GP practices patient participation group, share your patient story with us, join Health Watch Somerset, follow us on Twitter or Facebook, attend a governing body meeting, or join our Somerset Engagement and Advisory Group. We'd love to have you involved. And back to Ed Ford.
Thank you. So that was been really good presentations from everyone. So we're now on to questions and answers, and we've had huge number. We've had 6 in advance plus quite a few in the chat, so I am going to have to prioritize them because I think a few of them we've touched on so far in the commentary. So I'm going to kick off, as we only have about just 10 minutes left, with the first one, which is from Anonymous, and it's about oral health. So oral health can be a good indicator of a person's overall health. What evidence we have suggests that the overall oral health of Somerset children and adults is alarmingly low, although maybe no lower than regional and national benchmarks. For example, the percentage of 3 and 5-year-olds with decayed, missing or filled teeth has been quoted at as between 10 and 17%. This percentage should be very close to 0. Given that children grow into adults and the best possible standard of oral health in a child's early years is a vital part of prevention, can the Chief Executive reassure me that the Somerset ICS will give a higher priority to Somerset's oral health and fund it accordingly? So, Trudy.
So thank you for that. So yes, oral health is really important and often is a precursor to all sorts of other health conditions as well. So the responsibility for oral health is split between a number of organisations at the moment. So the whole population oral health promotion work is the responsibility largely of the County Council. The commissioning of dentistry services is particularly the responsibility at the moment of NHS England. But the important thing is actually that responsibility is due to move into the new integrated care system that James was talking about earlier, which gives us a really good opportunity to bring services together with prevention. So we have got a service in Somerset, which is an oral health promotion service. We've recently recommissioned that service and actually put some more money into it when it's due to launch in October 21 again. And the whole premise of that, the objectives are around promoting good oral health, but also reducing the inequalities in oral health. And the kinds of services that provides, the kind of interventions that provides is around supervised toothbrushing, for example, oral hygiene, pack distribution, particularly to particular populations, fluoride varnishing programs, There's a whole range, and the whole idea of it is it very much focuses on those that are at risk of poorer oral hygiene. So particularly young carers, homeless population, traveller populations, resettlement families. And the other part of that service is that it does also provide quite considerable workforce training for other parts of the system that have an opportunity to promote oral health. So, for example, the public health nurses, which work through the Healthy Child Program with families with young children. We do lots and lots of work with schools, the early years settings, and also smoking services, things like that. In addition to that, we've also, if you've not seen it already, we've also cracked off last year with the Somerset Sugar Spark campaign, which is a really important part of the picture. And so it's a national campaign led by Jamie Oliver and Sustain. And it's now, as a result, we've put oral health as a really integral part of the Somerset Wellbeing Framework that we use through schools. So it encourages schools to really look at sugar-free packed lunches, look at improving what's available in tuck shops and vending machines, promote easy access to fresh drinking water so as children and young people don't necessarily have lots of sugary drinks, all sorts of things that all contribute to the picture. But I think the really important point is, in short, the bringing together of it all under the ICS actually really provides us with a fantastic opportunity to bring together dental services with those prevention kind of activities and have more of a whole system approach.
Thank you, Trudy. Thank you. So I'll move on to a second question, which we haven't really been answered or sort of covered, which is, with patients being returned to their homes as quickly as possible, which I know in most cases is the best for them, what provision do you envisage for the increased support that will be needed for their unpaid carers? They are so often taken for granted, but have already been suffering increased mental and physical ill health as a result of COVID lockdowns. So Neil, that's got you all over it.
Thanks, Ed. We do have a dedicated carer support service. It's jointly funded by the CCG and the County Council, and it's provided by Community Council for Somerset. We'll send out a more detailed response to this, but it's available at our website, somersetcarers.org. This has a dedicated helpline, website and online support group, and can link people with a wide range of support, and it also includes signposting people to a formal carers assessment, which is a legal duty of the County Council to provide, which can result in extra support and carers breaks. And there are some further elements we can add, which we can respond to in a bit more detail.
Okay, thank you, Neil. I think what I'll do is I'll move on to, there's a couple of public health type questions that were in the commentary. So the first one was from Michael. Does Professor Grant feel that we should consider further lockdown restrictions in the forthcoming weeks to try to reduce the rise in infection rates that we're currently seeing? And then there was another one that related to, that I'm struggling to find at the moment, related to Trudy lobbying of Parliament. Here we go. From Peter, SCC often posts on Facebook urging the wearing of masks in shops and on public transport. What representations has the Council or CCG made to Somerset MPs to persuade the government to make this mandatory? I don't know whether, Trudy, if you want to cover those off together, just from a timing perspective.
Yeah, very happy to. So throughout the pandemic, I've met with our MPs every other week, pretty much, so once every 2 weeks. They've been really helpful conversations. Actually, we've been able to give the MPs our current position with our infection rates, make sure they understand where we're at in the county, but also we've had some really useful conversation about what some of the local approach has been, what some of the national approach has been, and where we've got issues which we've asked them to raise for us on our behalf. So actually those conversations have been really useful. So at times we have used our MPs to say, could you please lobby for this? Could you please make sure that you say this in the right places, kind of thing, and they have been doing that on our behalf. At the moment, obviously, the recommendations are nationally that the face coverings aren't necessarily mandatory. They are at the moment being used for school transport services, but not necessarily on all public transport. I would say face coverings is only one of the interventions. So, you know, we've got plenty that we could, hands, face space, ventilation. Ventilation is really, really important. We've learned throughout COVID. So at the moment, I would say we have used our MPs. We will continue to use our MPs, believe me. And if our infection rates can go up to levels that I get concerned about, then I will be absolutely making sure I use our MPs to ask for further measures to be put in place. And the second question was around the lockdown. I mean, I think, again, it's one measure. What we've had to do throughout this whole pandemic is to weigh up the direct risks of the infection, direct risks of COVID, with the indirect risks. And the indirect risks are huge as well. So, you know, the risk to our economy, the risk to jobs, livelihood, the risk to our education, all sorts of things. And importantly, particularly for lockdown, actually the risk to our emotional health and well-being. So all the way through, it's about weighing up the risks and making sure that we are taking the right decisions based on that weighing up of risks. I would say I certainly wouldn't ever rule out further restrictions. If we got a different variant which had a degree of vaccine escape, for example, we may well need to look at all sorts of different measures. Again, let's hope we're not in that position. In the meantime, all of us can do absolutely everything to make sure that we, you know, carry on washing your hands, meet outside where you can, good ventilation, all of those measures. Just, you know, we can all do them voluntarily, and I would encourage that absolutely all the way through. But at the moment, I would say our infection rates are coming down. They're not rising at the moment, and if they do get up to the levels where I'm getting concerned again, I will be absolutely having those conversations with our Somerset system and with our local MPs.
Okay, thank you. So we are literally at just 15:15, but I've just noticed that there's a very quick question from Anne that's come at the end, which is, I think, probably quite pertinent with some of the stuff that's going on in the media at the moment, that I think probably I ought to answer, which is, why is that we have no one wanting to become a doctor, as we seem to have a lack of doctors? When are we going back to seeing our doctors? This is causing very bad feeling towards the health service. And I think actually some of what is in the question answers itself, because a lot of the negativity being expressed towards doctors, particularly in the medical, in the media, is actually making it very unattractive to be a doctor at the moment, because fundamentally, as a clinician, we want to help people. I also think we need to make sure that we don't undervalue all our other healthcare professionals who provide a really good service, and not everyone needs to see a doctor. But people do seem to have become fixated on saying, well, I want to see a doctor and I want to see them now. And fundamentally, we have to remember that how we were working before the pandemic, there were still quite long waits, and it wasn't a perfect system. So I think there does need to be an honest conversation about what sort of service we want, what expectations there are, because if we keep setting up doctors particularly to fail because we can't provide the services and everything's got to be doctor centric, then unfortunately we are going to see people not wanting to enter the profession. So I do think that this needs to be one that's taken up, particularly with the politicians, to have an honest conversation with the public about expectations of the health service, to reset you know, what it is a doctor does. And actually there are plenty of nurses, paramedics, physios who do the job probably sometimes even better than we do. So on that note, I'm going to bring the meeting to a close. You can contact us if we got the last slide. Here we go. Yeah. So it's how to contact us, and a recording of the AGM and copy of the slides used tonight will be available on our CCG website in the near future. So only 3 minutes over. I'm going to draw the meeting to a close and thank everyone for coming, and have a wonderful evening.